Well, good morning, everyone. Today is our briefing for April 8th, and Kelly Colopy, our Health and Human Services Director, is going to go ahead and join us in just a minute, and she's going to go over a bunch of data that we have as well. We're going to go ahead and provide a vaccination distribution and update. I'm also going to just mention kind of what's a little bit about what's happening at the convention center with the Biden administration request. And most importantly, go over an announcement as it relates to vaccines, which I think is pretty exciting. Let me just start by just mentioning we have lost 920 members of our city now to COVID-19. That is a very large number, and our love and prayer go to all the families. We have also learned from the governor that our blueprint for a safer economy is now transitioning. So I just want to make sure everyone knows that starting June the 15th, the state is moving away from the color-coded system and now really moving forward to really reopen the state. There will still be some requirements and masking, of course, and other requirements. But essentially, if we meet a couple of metrics and hospitalizations remain low and vaccine supply is sufficient, then the state is really going to begin to reopen, and restrictions that are currently in place will not be in place anymore. So that is good news, but we've of course got to keep the work and the hospitalizations down. Now I want to talk about vaccinations. The exciting news is that as of this morning, we have had over 163,000 Long Beach residents that have at least received their first dose. The percentage there is about 43.2% of all eligible adults have been vaccinated in Long Beach. So if you're eligible for a vaccine, essentially, if you're 16 and if you're over 16, that population, that's over 43%. That's a really impressive number. And all this data, of course, we put on the website. And if you look at just our older adults, so those over 65, 86%, 86 of older adults have been vaccinated. That is also a really impressive number, and we are really outpacing where the country and the state has been on these numbers. So thank you for getting vaccinated. Almost all of our older adults, we're heading a point now where we're having to really reach our older adult population, where we have mobile clinics, literally where we're just going to people's homes that are either immobile or unable to come to a vaccination center and vaccinating people one at a time. We're going to senior buildings, knocking on doors to see if people have not been vaccinated yet. But we have really done a great job with our older population. And I just want to thank our partners in the older adult community, the workers that are working going door to door, the mobile clinics, the hospitals, because we are nearing 90% of this population, and that's quite an accomplishment. But again, 43.2% of eligible adults have been vaccinated. Now, with that, we want to go ahead and make an announcement today, which we are excited about. So starting immediately, as in right now, Long Beach is transitioning to be vaccinating everyone. And that means if you are 16 and over, starting today at our vaccination sites in the city, Long Beach is transitioning to vaccinating. If you are a resident of our community and you're over 16, you can now get vaccinated. Now, we know this is prior to the April 15th date set by the state, but I want to share with folks how that is possible. Because of our progress, we feel comfortable and confident that we can begin now vaccinating the general population. I want to make sure that we know how we can get that done, though. Between now and April 15th, we will be vaccinating 16 plus, anyone that wants a vaccination, at the walk-up at the convention center. So it's by walk-up only. This is a no appointment system. We will be doing at a minimum 500 of these a day, but oftentimes we do up to 1,000 of these walk-ups. And so there is, of course, a limited supply of these walk-ups, but beginning today, folks can walk over to the convention center and receive their vaccination. Now, beginning April 15th, you'll be able to, of course, make appointments on the MyTurn site. But just note that MyTurn is not accepting appointments for 16 plus because the state has not turned that on and the County of Los Angeles has not turned that on. But there have been some small sites up and down the state that are beginning to do this. We feel that we can do this health jurisdiction wide. So this is a full Long Beach program, and we'll be informing all of our local partners of this change as well. So please, if you are a Long Beach resident and you want to get vaccinated and you're over 16 years old, you can walk to the convention center Monday through Saturday, 11 a.m. to 2 p.m. and receive your vaccine. And because of the high demand, if you are in line and we run out for that day, which does happen, we will make an appointment for you on the spot so that we're able then to vaccinate you maybe the next day or the day after. And so again, Long Beach leads the way. We, I think, have done a great job of setting the pace for the rest of the state. As some of my friends in Sacramento keep reminding me, which I think is great for us as a city to be able to do. So we're proud to set the pace. Long Beach, you all can get vaccinated starting today, and I'm really, really proud of this. It's been an enormous endeavor getting here. But I want to thank our health department and our health team. In light of that, it's also National Public Health Week, and so I think it makes sense to, at this moment, just thank Kelly Colopy, who you'll hear from, Dr. Anissa Davis, our health officer, and every single person that works or volunteers at our vaccination centers or our testing centers. Thank you, and I'm really proud that we're at this moment. As I transition, I just want to remind folks that you can still sign up on MyTurn. If you want to get an appointment, we encourage folks to do that. Please do so today. And if you have a question, you can also continue to call or contact the Long Beach Health Department. Now, I want to just also add, before we go into some data that Kelly Colopy is going to go over here, as you probably all know, just a couple of days ago, the Long Beach City Council unanimously voted to enter into contract negotiations with the federal government, in particular the U.S. Department of Health and Human Services, to house and facilitate a family reunification center for migrant children here at the convention center. We know that this is an enormous humanitarian challenge that is currently happening at the border. We also know that cities across the country are being asked to engage and do this work and to support our country's efforts in a complex and challenging time. As a city, we know that we have a long history supporting refugees and immigrants. I think about our Cambodian community. I think about the work that our churches do to help immigrants in our community. And I think about just the natural compassion and kindness that our residents have. And I know that we can take on this challenge in a way that centers the children, that focuses on quick reunification and a center that is temporary. This is a temporary reunification center at the convention center. And the idea is to get kids and these children quickly from once they arrive to their family or to a sponsor. I also want to let folks know we have been overwhelmed in a really wonderful way with support and with just messages of wanting to help. Please know that in the next day or two, we will be officially letting everyone know how they can participate, volunteer, and support these efforts. And so as soon as we are creating a portal, an online portal for the community, and that should be completed in the next day or two, and we will be putting that out to our friends in the media and to the greater community, and that'll show folks how they can get involved right away. And so we want to thank everyone, and I want to thank the Long Beach City Council for their unanimous and strong support. And as a reminder, this new program and center has no impact on the vaccination program that is happening just next door, and is at no cost to the city of Long Beach. The federal government is paying for every penny, and they're going to leave the convention center, we think, in even better shape than they found it. So we are grateful for that. And with that, I'm going to turn this over to Kelly Colopy, who will be giving the rest of an update, and then we can answer any questions. Ms. Colopy.
Hi, good morning, everybody, and thank you, Mayor. Today I'm going to share data to give you a sense of where our transmission indicators stand, and so that you'll be able to see all the progress that we've made over the last months. Overall, just as a starting point, is we've seen a dramatic decrease in our cases since the winter surge, and we continue to hold steady and to continue to go in the right direction. You can see from this graphic, this is a graphic of our cases, our hospitalizations, and our deaths, and you can see the surge that really hit in the highest point was mid-January, and just the tremendous decrease in stabilization at a much lower number. So you'll see about 3 months ago, we were at the height of the pandemic. The average daily case rate was 739. It has dropped 96% to an average of 31 cases per day. During the same time period, daily hospitalizations were down 94% and daily deaths are down 98%. Also, since the height of the surge, the positivity rate has decreased 91% and the case rate is down 96%. So if you look at these two graphics, what you'll see here is that in the last 60 days, we've gone from a positivity rate of 7.8% to 1.7%, which is a 78% decrease. And we've been holding pretty steady right in that area. So we're very proud of that number. And then you also see that our case rate has dropped in the last 60 days from approximately 42 per 100,000, and it's now at 5.3, which is also an 87% decrease. So these have really stabilized in the past weeks and have allowed us to really to be able to open more, to be able to really support people in our communities and our businesses. Both of these, the case and positivity rates are lower now than they ever were compared to prior to the surge. They're the lowest that we have seen them. Long Beach, as well as the surrounding Southern California counties, are doing better on the indicators than the statewide average overall. We're seeing significantly fewer hospitalizations due to COVID-19, and this is just an incredible number. In Long Beach residents, at the height of the surge, we had 304 Long Beach residents who were hospitalized. Now we have 43. It's an 86% decrease. When you look at our area hospitals, the 5 hospitals, they originally had 598 at the height of the surge. There are now 34 people who are hospitalized, which is a 94% decrease. And the mayor did mention we have lost 920 Long Beach residents to COVID-19 since the beginning of the pandemic. Those have decreased at the height of the pandemic, we had 12 people dying every day. And now we have less than 1, which we agree is 1 way too many. And our thoughts and sympathies continue to be with everyone who has lost a family member, friend, neighbor, or coworker to COVID. They certainly are not forgotten. While these trends continue to steadily decrease, we don't want to lose traction and experience another surge due to community transmission and disregard for public health. We remind people that if we really want to get to that June 15th opening, where everybody can start to get back to what feels like normal, it means that we have to continue to wear our face coverings in public. We have to practice strong physical distancing. We have to keep washing our hands, and we absolutely have to make sure that we're getting vaccinated. Everybody in our city over the age of 16 is now eligible to be vaccinated, and we encourage you to get to the convention center, to any of our pop-ups in different communities to make sure that you can receive your vaccine. It is our shared responsibility for the health and wellness of all of us to practice these measures so that we can continue to get on the right path to recovery. As the mayor also mentioned, this is National Public Health Week, and I'd like you to join me in celebrating the more than 500 staff members of the health department who are working hard to keep our city safe, healthy, and well. They're doing a yeoman's job really right now addressing the pandemic while also operating more than 40 programs across the city. They've been working tirelessly through this pandemic, and they are truly your public health heroes for the city. We normally have a large conference at this time of year. We always have numbers of activities. Last year, we canceled the conference right as COVID hit. Again, we canceled it this year. And in fact, we've just been so busy doing public health, we haven't had an opportunity to celebrate. So I want to give a big shout out to all of our team for all the work that they're doing, and that we know all of the work, and that this is the time to really celebrate all of you. As you know, Long Beach is one of only 3 city-run health departments in California. It's been improving the health of Long Beach for over a century. Not only do we prepare for and respond to public health emergencies like this pandemic, which has really elevated public health in the community in terms of knowledge. But we also provide nutrition supports to build healthy access to healthy foods. We provide fitness opportunities. We assist older adults and young children and families. We do food facility inspections and test the waters to ensure safety. We spray for mosquitoes. We visit people's homes through our public health, with our public health nurses and our family preservation teams. We support mental health. We provide family planning, prevent and treat tuberculosis, HIV, and STDs. We're providing youth development services and violence prevention in our communities. And we're housing people through our homeless services and the Housing Authority. It is a big organization doing great work across the entire city. This past year, we've overcome new challenges with the aid of all levels of government, schools, existing collaboratives, nonprofit agencies, communities, and individuals to confront the impacts of COVID-19. They've all become public health professionals, and I celebrate all of you and all of them. And I'm just so proud of the accomplishments always, but particularly in this past year. It's a pleasure to work with such a talented and committed staff and all the amazing partners, and we look forward to continue our work together and to keep Long Beach healthy and safe. And with that, I'll turn it back to the mayor. Thank you.
Now we'll take questions from the media. As a reminder, we'll be asking, each reporter will have an opportunity to ask one question. Additional questions can be sent to the Joint Information Center email. Kelly from the Long Beach Post, please unmute yourself and let us know who your question is for.
Can you guys hear me? Okay, thought I was unmuted. Hi, Kelly. This question is for Kelly Colopy. I had a question about vaccination rates. It's amazing that we've reached such a high level, but if you look at the disparities, there's still significant disparities among the zip codes in different parts of the city. Is there any way the city's going to be moving differently moving forward? And is there some concern that Long Beach may just reach a certain plateau by not being able to get more people vaccinated in certain parts of the city?
We're actually working very hard to get more vaccine more localized. And so we are continuing with the pop-ups, and we foresee that we'll be implementing regular locations throughout our communities where the vaccine rates are a bit lower. So that is in progress. We'll also be implementing a bus shuttle from various communities that have been hardest hit by COVID, so that they will be able to take a direct shuttle to the convention center for access to the vaccine that will have a sort of specific access line for whether they have appointments or no appointments, and to be able to support them in making appointments as well. So we continue to push, and then really working more and more closely with our community-based organizations, our trusted messengers, the voices in the community. They are going door to door and helping to support people signing up for vaccine, sharing information, and doing everything they can to help people register. They're also running, some are running call locations where they're helping people to make appointments through MyTurn and others. So the efforts continue, and we're really doubling down on our efforts to make sure that all communities have access to the vaccine.
Thank you, Kelly. Haley from the Press Telegram, go ahead and unmute yourself.
Hi, my question is also for Kelly. So first, just to clarify on the eligibility opening up, does this apply to residents and workers in Long Beach, and will people have to provide documentation? And then I also wanted to ask just about vaccine supply. I know that was an issue a month or two ago, and so can you just provide an update on what that looks like now?
Yeah, so the initial vaccine, the 16 and over until April 15th will be specific to those who live in Long Beach. And then as of April 15th, it will be for those who live and work in Long Beach and those eligible to make appointments through MyTurn. So that's that piece of it. Vaccine supply continues to be an issue. So it has stabilized. We saw some increase a couple weeks ago. It has stabilized. We're receiving approximately between 17 and 20,000 doses per week, as in terms of first doses, and then supporting second doses as well. And so it has stabilized. The federal government and the state is indicating that starting in May, we'll see quite a bit more. And so we are anticipating an increase in the supply, which will allow us to get that out the door. We do have capacity at the convention center to do at least 6,000 doses per day. And so as vaccine allows, we'll just continue to ramp up those efforts to make sure we can vaccinate as many people as possible, as well as in our communities most impacted by COVID.
Great, thank you. We also have a question from Julie Stone at ABC7. With the new variants just discovered, the Brazilian and South African variants in the county, what concerns do you have that it might be spreading quickly in the community?
Yeah, so at this time, the vaccine has been demonstrated to continue to be effective against the variants. And so really our push is to make sure that people are getting vaccinated so that those variants don't have the possibility of taking hold at a high level. So far, we're not seeing a wide-scale increase or wide-scale spread of these variants, but we are focusing very closely and really working. It just means that we have to be even more focused on all of our masking and distancing and other protocols and making sure that people are getting vaccinated.
Great, thank you. Jason from the Long Beach Post, go ahead and unmute yourself and ask your question.
Hi, can you hear me?
Yes, we can.
This question is for the mayor. So we've learned through discussions with officials in San Diego that County Supervisor Nora Vargas was contacted directly by Secretary of Health and Human Services Javier Becerra directly with a personal request to consider that site be open to migrant children. So we were curious who from the federal government reached out to Long Beach about our convention center being used. Who did they talk to, and when did that happen?
I think, just to reply, I think the question was who reached out from the administration to the city and when did that happen? Was that the question? It came out a little blurry. Is that right? Okay.
Yeah, who did they talk to, and when did it happen?
Jason, I can get you the exact date. I mean, the initial reach out was probably a week and a half ago, not more than 2 weeks ago. The initial reach out was to my office directly from the White House. And then quickly, we began, of course, working with HHS. I'd have to get you the exact date, but I had, I think, probably the first conversation, and my chief of staff probably had the second or third conversation, and then we brought in the city and everybody else.
Thank you, Mayor. The next question is from Jeremiah Dobrik at the Long Beach Post. Jeremiah, please unmute yourself.
Hi, guys. Thanks, as always, for taking our questions. Mine's for the mayor also, and it's about the city council process about approving the shelter, the convention center. We've talked to a few people who spoke to the mayor's office before the city council item went public. Essentially, asked to support this item, comment on this item, help support it. And because there was such short notice, there's a small window to sign up to comment on this item publicly on the city council agenda, combined with the fact that there's a cap of only 20 speakers now. Some people were not able to sign up in time. We know there were people who wanted to comment, some of whom were opposed to the shelter who weren't able to comment on it. So what ended up happening was that the comments were overwhelmingly positive that night. Many of them were from people who are connected to your office. So my question is, was there an effort to kind of stack the deck and support here to push out any possible negative comments? And doesn't that circumvent the intended process of the public comment process?
Well, first, I think the response has been overwhelmingly positive. I mean, certainly in the messages I've received in comment, but not every comment actually was even, I think, taken up. There's public comment first at both the agenda item and in the closed session. I think we had some folks sign up for both. Absolutely. I actually hosted we invited maybe 25 to 30 nonprofit providers that would be doing the work. We invited them to a conversation to give them a kind of a heads up the day the item went public. Absolutely. We want to encourage them to give their support. But I think that one of the great things about public comment is you can comment, you can e-comment. we've been receiving emails, and so there's a lot of ways, obviously, of giving your input. And I think all the council members will tell you that they received a variety of comment from email, from public comment, from social media, and so we'll continue to receive comment. But as far as the overwhelming support that I've received, or folks that have called me, reached out, have been absolutely positive.
Thank you. Our final question comes from Melissa Evans at the Long Beach Post. Melissa, please unmute yourself.
Hi, so my question's for the mayor as well. And just to follow up on Jeremiah's question. So we know that most of the council members knew about the convention center and the HHS, the conversations with the federal government by at least maybe mid last week on the 31st. But the special meeting wasn't agendized until about 4:45 on Monday, which is right before the cutoff. I'm just wondering why the meeting wasn't agendized sooner, which would have given, residents a little more time to maybe, offer to want to speak at the meeting, or just give people a little more heads up about that the meeting was happening.
Yeah, that's a good question. Actually, I think you should ask definitely the city attorney. So we actually tried to agendize it earlier. We were pushing to try to get it agendized, if possible. I wanted it on the agenda as soon as possible. In fact, we were hoping to even make it onto the supplemental agenda on Friday for Tuesday. But the city attorney also, we're working really hard to make sure that we got confirmation. We didn't actually have confirmation that it was going to be a go until actually Monday. And so we certainly had heard that it was a possibility. We knew that we were in the mix, but we did not hear officially. And the congressional delegation, if you ask, for example, Congressman Lowenthal or Congresswoman Barragan, the official confirmation to the congressional delegation, which is basically what makes it official, didn't happen till, for most folks, Monday afternoon. And so we worked with the attorneys to get everything prepared, and as soon as we could, we posted it.
Thank you. And now we'll have a Spanish translation.
Buenos días, hoy es nuestro comunicado para el 8 de abril del 2021. Hoy nos acompañó Kelly Colopy, la directora de Salud y Servicios Humanos, y también nuestro alcalde García. Empecemos con una actualización sobre COVID-19 y después información sobre la distribución de vacunas. Hasta el día de hoy, 52,398 residentes de Long Beach han dado positivo por COVID-19 y trágicamente hemos perdido un total de 920 residentes de Long Beach por este virus. Como habrán escuchado a principios de esta semana, el Estado anunció que si continuamos en nuestro camino de progreso contra COVID-19, podemos esperar la reapertura completa de nuestra economía el 15 de junio. El Estado se alejará de su sistema de niveles codificados por colores que regula las actividades y los cierres de sectores por condado si cumple con estos dos requisitos. La primera es si el suministro de vacunas es suficiente para mayores de 16 años que deseen vacunarse, y la segunda es si las hospitalizaciones son estables y bajas. Todo nuestro estado entrará en la nueva fase al mismo tiempo. Se permitirá la reanudación de las actividades cotidianas y se eliminará la mayoría de los límites de capacidad. Esto es una gran noticia, pero nuestro trabajo aún no ha terminado. En otras noticias, a partir de hoy, anunciamos que cualquier persona mayor de 16 años o más que vive en Long Beach es elegible para vacunarse. Hasta la fecha se han administrado 229,052 dosis de vacunas en Long Beach, y de estos 138,753 son de primera dosis y más de 90,000 son esas segunda dosis. Seguiremos comprometiéndonos a hacer que las vacunas estén disponibles para la mayor cantidad de personas posibles y nuestro programa de distribución de vacunas sigue siendo un gran éxito. Le voy a dar información sobre, más información sobre la cantidad de personas que han recibido las vacunas. 163,372 residentes de Long Beach han recibido al menos una dosis de la vacuna. Por porcentaje, eso en todos los residentes es un 34.6% de nuestros residentes que se han recibido una vacuna. Y si quitamos solamente a las personas que son elegibles, 16 o mayor, el 43.2% de los residentes de 16 años o más han sido vacunados, y de los residentes de 65 o mayor, esos adultos mayores, el 86% de esos residentes han sido vacunados. 3 vacunas aprobadas, que incluye Pfizer, Moderna de 2 dosis, y la vacuna Janssen de Johnson & Johnson de una dosis única, han demostrado ser muy eficaces contra la enfermedad grave de COVID-19 y también la muerte. Y aunque podemos recibir cualquiera de esos 3 tipos, solo la vacuna Pfizer está autorizada en este momento para uso en personas de 16 y 17 años. Cuando busque una cita para este grupo de edad, 16 o 17, confirme qué vacuna se está utilizando en el centro de convenciones ese mismo día para poder garantizar esa disponibilidad. Las vacunas se administrarán de forma gratuita y han sido proporcionadas directamente por el gobierno federal. Debido a que el portátil de citas del Estado no permite actualmente citas para personas de 49 años o menos hasta la próxima semana, le vamos a recomendar que aprovechen nuestro proceso de vacunas sin cita previa. Tenemos un número limitado, aproximadamente 500 vacunas sin cita previa para los residentes de Long Beach, disponibles de lunes a sábado de 11 de la mañana a 2 de la tarde. Esto es en el centro de convenciones aquí de Long Beach. Siga las señales que dice Walk Up, que es accesible según la ADA. Como recordatorio, las vacunas sin cita previa se ofrecen según la disponibilidad de vacunas y no están garantizadas. Si se toman todas las vacunas sin cita previa ese día, ellos le ofrecerán una cita futura, si es que llegan y ya no hay esas vacunas. Las personas deben poder demostrar que viven o trabajan en Long Beach. Además, la distribución de vacunas en el centro de convenciones. Continuamos brindando vacunas a través de nuestras clínicas de vacunaciones móviles, específicamente para aquellos en vecindarios más afectados por COVID-19, así como a través de nuestros vehículos de vacunaciones móviles que administran vacunas a los residentes confinados en el hogar y otras personas en barrios más afectados. Si desea programar una cita en línea, visite el portal de vacunación del estado MyTurn, que se deletrea myturn.ca.gov, o puede llamar a la línea directa de COVID-19 del estado al área 833-422-4255. De nuevo es 833-422-4255. Recuerde que el estado ahorita en ese momento solamente está ofreciendo vacunas para personas 50 o mayor hasta la semana que viene. Si desea, ahora voy a compartir datos para darle una idea de dónde se encuentran nuestros indicadores de transmisión hoy, ya que hemos visto un progreso tremendo en los últimos meses. En general, Long Beach ha experimentado una disminución drástica de casos desde el aumento repentino del invierno, y seguimos manteniéndonos firmes en la dirección correcta. Hace unos 3 meses, en el punto alto de la pandemia, la tasa promedia diaria de casos era de 739 por día. Desde entonces ha caído un 96% a un promedio de 31 casos por día. Durante el mismo periodo de tiempo, las hospitalizaciones diarias se redujeron un 94% y las muertes diarias en un 98%. Además, desde el punto álgido de la oleada, la tasa de positividad disminuyó un 91% y la tasa de casos disminuyó un 96%. En los últimos 60 días, nuestra tasa de positividad ha disminuido drásticamente del 17.4% al 1.7%, una disminución del 78%. Y nuestra tasa de casos también se redujo en los últimos 60 días de 42 a 5.3. Ambas tasas son una realidad incluso más bajas, más bajas ahora en comparación antes de que comenzara ese aumento que vimos el año pasado, finales del año pasado, principios de este año. Long Beach, así como los alrededores del sur de California, tienen mejores indicadores que en comparación con el estado de California en general. Estamos viendo menos hospitalizaciones debido a COVID-19. Los residentes de Long Beach que están hospitalizados pasaron de 304 en el pico del aumento a 43 residentes que están ahorita hospitalizados. Las hospitalizaciones en el área de Long Beach pasaron de 598 en el pique a 34 en la actualidad. Recuerden que esto va a incluir, son hospitales en el área, pero puede incluir residentes que no viven en la ciudad. Como mencioné antes, hemos perdido un total de 920 residentes de Long Beach a causa de COVID-19 desde el comienzo de la pandemia. Las muertes han disminuido de un promedio en el punto alto del aumento de 12 muertes por día, ahora un promedio de menos de una muerte por día por este virus. Dicho esto, una muerte es demasiado y nuestros pensamientos y condolencias están con todos los que han perdido a un familiar, amigo, vecino o compañero de trabajo a causa de COVID. Aunque esas tendencias continúan disminuyendo de manera constante, no queremos perder esa atracción y experimentar otro aumento debido a la transmisión comunitaria y al desprecio por la salud pública. Recordamos a las personas que continúen cubriéndose la cara cuando estén en público, practicando este distanciamiento físico y lavándose las manos y desinfectando áreas de alto contacto con frecuencia. Esta semana es la Semana Nacional de la Salud Pública y me gustaría que nos reuniéramos para celebrar a los más de 500 miembros del personal del Departamento de Salud que están trabajando arduamente para mantener nuestra ciudad segura, saludable y bien. Están haciendo un gran trabajo en este momento para abordar la pandemia y al mismo tiempo operar más de 40 programas en toda la ciudad. Normalmente tenemos una gran conferencia y una serie de actividades en toda la ciudad, pero han estado tan ocupados con la salud pública que no hemos tenido la oportunidad de celebrar. Como usted sabrá, Long Beach es uno de los 3 departamentos de salud administrados por la ciudad en California y ha estado mejorando la salud de la comunidad de Long Beach durante más de un siglo. No solo respondemos para prepararnos y responder a la salud pública a emergencias como esta pandemia, pero también brindamos apoyo alimentario y acceso a alimentos saludables. Ayudamos a los adultos mayores y a los niños pequeños. Hacemos inspecciones de las instalaciones de alimentos y analizamos las aguas para garantizar la seguridad. Rociamos contra los mosquitos, visitamos los hogares de las personas con nuestra planificación familiar, prevenir y tratar la tuberculosis, el VIH y la ETS, brindar desarrollo juvenil y prevención de la violencia en nuestras comunidades y albergar a las personas a través de nuestros servicios para personas sin hogar y la autoridad de vivienda. El año pasado superamos nuevos desafíos con la ayuda de todos los niveles de nuestro gobierno, escuelas, colaboraciones existentes, agencias sin fines de lucros, comunidades e individuos para enfrentar los impactos de COVID-19. Estamos muy orgullosos de nuestros logros. Es un placer trabajar con personal tan talentoso y socios increíbles y esperamos continuar nuestro trabajo juntos para mantener Long Beach saludable y seguros. También queremos extender nuestro agradecimiento a nuestros socios de salud pública federales, estatales y del condado. Están haciendo un trabajo increíble para nuestra comunidad. Ahora vamos a hablar sobre el apoyo para niños migrantes. Ha habido bastantes preguntas sobre la reciente decisión de asociarnos con el Departamento de Salud y Servicios Humanos de los Estados Unidos para albergar y facilitar la unificación para los menores y ofrecer ese albergue aquí en el centro de convenciones de nuestra ciudad. Para empezar, queremos que todos sepan que esto de ninguna manera va a afectar a nuestro programa de vacunación. El centro de convenciones va a continuar ofreciendo esta operación de vacunaciones en la estructura de estacionamiento y también en el Teatro Terrace. Segundo, estamos orgullosos de la decisión de nuestro ayuntamiento y comunidad esta semana pasada sobre la discusión de este tema. La pregunta es que si Long Beach va a apoyar a estos niños y a nuestro país frente a esta crisis humanitaria, y la respuesta es 100% que sí. Somos una comunidad con compasión y queremos ayudar a estos niños a unificarse con sus familias en los Estados Unidos o con un patrocinador aquí en los Estados Unidos. Estamos agradecidos de la respuesta inmensa y cantidad de interés de la comunidad para poder ofrecer apoyo y recursos a estos niños. Esto es todo por hoy. Les agradecemos por acompañarnos. If you have just joined during our Spanish translation, please visit our Facebook page, the City of Long Beach Facebook page, to see this press briefing from the beginning with the Director of Health and Human Services, Kelly Colopy, along with our Mayor, Garcia. Thank you for joining us. That is all for today.